My name is Andy Zinkovich. I'm the broker manager for Charlotte area, covering or for Cigna. I have with me today Lara Smith, the market manager for North and South Carolina, representing Cigna. And I'm heard Sophia mention that sometimes this could be a challenging population, but today we're going to go over some options and some ways that we can approach the veteran demographic and not make it as complicated as it needs to be. So we're going to be clarifying healthcare for our Medicare eligible veterans and their qualifying family members, because I think that's a spot we tend to miss a lot while we're in those households. So again, my name's Andy, Charlotte broker manager for Cigna. There's my contact information if you need to get in touch with me. We are going to do this presentation, and I'm going to share a lot of the documents that I'm going to show you here today. I'll get them emailed out so everyone can get access to them. But even if you're out in the field and you're getting ready to go meet a veteran or the spouse of a veteran, and you're like, you know what? I need to get a quick little refresher before I go in and make this sale. There's my phone number. Give me a call or give a call to any one of our BSRs, and they'll make sure to get in touch with me or anyone else on our team that can get these questions answered for you so we can get going with that. So real quick, our agenda today is going to be VA, TRICARE for Life, CHAMP VA. What even are they? Sometimes we mix these together and think one's the same as the other, but they are all three different. Then we're going to see them side by side in a nice little graph that you're going to want to take a picture of, snap a shot of, little one pager for you. And then we're going to go into how VA works with Medicare or how it doesn't, how TRICARE for Life works with Medicare or how it doesn't, and then how CHAMP VA does the same, right? So CHAMP VA we're going to spend a little bit less time on because it is going to interact with Medicare, just like TRICARE for Life, with a little bit of different payers, and we'll go over and cover that. Then we'll go into some field engagement. Like I said, I'll share those resources with you. I'll show you what they look like, where to find them online. And again, I will be emailing that out to Sophia and the team to make sure that it gets to you. And then at the end, we'll have that final question slide. But while through this presentation, Lara will be monitoring the chat. So if you do have a question, just type it in there and we can stop the presentation real quick and get that question answered for you. Before we get going on this, though, I do want to hand it over to Lara because we have some exciting news at Cigna. As you've probably all heard, March 19th, we were purchased by HCSC. That purchase finally went through. And Lara has some nice information she wants to share with you that'll be coming out soon.
Hi, everyone. Again, I'm Lara Smith. I'm the sales manager for North and South Carolina. And as Andy said, we were purchased. So we are coming to you as Cigna, but we were purchased on March 19th. So our plans throughout the rest of the year will be Cigna plans, but our parent company is now HCSC. So we're very excited. You are still going to be working with all of us. They literally just took our entire team and put us under the HCSC umbrella. But what we're really excited about is on, I believe, July 15th or somewhere mid-July, can't remember the exact date, we are going to be sharing our rebranding. So we are going to have a new name, a new logo, brand new colors, and that will be rolled out in the middle of July. So you'll either see that information in July when we start blasting via email, or as you come to any of our rollouts that we have. So we will be coming to you with a new name that we're excited about. You'll also notice that when you are going for your certifications, because we have to switch to some new systems, we most likely won't be opening up our certification until July 21st. So a little bit later than what you're used to, but it will be the same format as you're used to with Cigna, just a few weeks later than we had last year. So wanted to share that great news. Again, we're going to have a brand new name. We're going to have a new logo, some fun colors for our new brand. And when you see us for AEP, we'll have that new name and information. So wanted to share that with you. Again, if you have any questions, please put them in the questions or in the chat, and you can reach me, I guess reach Andy, because my information isn't on there, if you need to get in touch with me. So enjoy Andy's presentation. He's an expert.
Thank you, Lara. I appreciate that. So real quick, we're going to dive into some numbers, veterans population. Now, keep in mind, this is based off government data, so censuses, and there's all these years in between. But currently, estimated numbers here, we're looking at 20.3 million veterans nationwide. 9 million of those are enrolled in the VA. Only 6.1 million of those are even utilizing VA healthcare, because we're going to go into that. Just because you run into a veteran Doesn't mean they're in the VA system. That is something they need to sign up for. 8.6 million veterans nationwide are 65 plus right now. So our demographic we're looking at. But of that 8.6, here's the interesting thing. Only 3.2 million are utilizing VA healthcare. That means there's a huge number of veterans out there that are not utilizing VA at all, that are Medicare eligible. And we're going to talk about how we can potentially be helping them too, and creating community bonds within the area where you live with service officers and things like that to get those veterans connected to the VA, and then those service officers connecting veterans to you. So I'll cover that in a little bit. And then we have roughly 9.6 million veterans on TRICARE. And then from there, 2.3 of those veterans that are utilizing TRICARE are 65 plus. So we're going to go over that. What can we be doing for them? Are they fine where they're at? Yes, sometimes. What do we do if they want to get on Medicare Advantage? That's what we're going to cover. So first things first, like I said, we're going to talk about Veterans Affairs. Is it an insurance or a benefit? A lot of folks out here, we kind of get that confused. Even veterans themselves get that confused. Is VA an insurance or benefit? And the reason why we get that confused is for ACA purposes, VA is credible coverage. So a lot of people tend to use that in their head and say, oh, you have credible insurance coverage. But VA is not insurance. It is a benefit. And then once they become Medicare eligible, VA no longer becomes credible coverage for Part B purposes, but it does for Part D. So it is important that we remember that VA is just a benefit. It is not insurance. With that benefit, veterans are limited to VA hospitals or clinics. In your hometown, you might have what's called a value-based outpatient care clinic, or VBOC. That is a spot where veterans can go and meet their primary cares, get labs, your basic really medical procedures done instead of having to go to a hospital. Now, you might be questioning when I just said veterans have to go to the VA hospital or a VA clinic, but you're running into veterans all the time that are saying, I'm going to this doctor that's out in the community. Well, if you remember back in probably 2019, maybe even before that, there was a lot of veterans that were dying on waiting lists, specifically in Phoenix, Arizona, because they could not get into the VA. They couldn't get their appointments in time. So Congress rolled out a VA Choice Act. Now, that did not go as planned. It was a really good idea. It allowed veterans to go to civilian doctors with VA approval, of course. But then there was issues with billing and doctors getting paid. So in 2019, Congress revamped this, known as the VA Mission Act. Now, what that looks like is it does allow veterans to go to community care, but this isn't something they get to just do on their own. They need to have a referral from the VA. And with that referral, they're going to get basically an EOB that says, this is what you can get done from this doctor. And sometimes if that provider does extra services, VA might come back and say, hey, we're not going to cover that. That wasn't a part of the approval we sent you for. And now VA Mission Act and getting approved to use the community care network comes to them a couple different ways. One could be waiting time for an appointment. Say primary care, you can't get in to see your primary care doctor within 30 days. They can request to go see a primary care doctor in the community care network. For specialists, that jumps up to 60 days. And then we also have drive time. So here in North Carolina and South Carolina too, all over the place, you're starting to see more and more VA hospitals get built, which is bringing that bubble in, but we still have thousands and thousands of veterans that are outside of that bubble that are eligible for the community care network. So what I want you to do when you're sitting down with those veterans and you ask them, are you going to the VA and seeing civilian doctors? What I want you to ask them is, that civilian doctor that you are seeing, are you paying them or is the VA paying them? If the answer is the VA is paying them, then you know they're utilizing the community care network and got that approved. If they're paying the doctors, then you know they're obviously on some sort of healthcare plan that is picking that up. Now, with benefit coordination with the VA and Medicare, hopefully you out there know, and if you don't and you're new to this, there is no benefit coordination. So no matter what a veteran that is utilizing the VA solely for their care, no matter what Medicare plan they get on, whether that's one of the MA-onlys that became popular in many years, the MAPDs, as you know, here in the Charlotte market, Cigna had an MAPD with a $174.70 give back, which was very popular with veterans utilizing the VA. It doesn't matter which one they're on. There is no coordination there with VA and Medicare. And then opportunities, this is aligning more towards that Medicare side. Why would veterans that are going to the VA want to utilize Medicare Advantage? Well, for one, we don't know what VA funding is going to look like, or second opinions. Very difficult to get a second opinion in the VA, right? We're talking about a hospital system that has now taken on thousands, if not millions, of veterans from the last 20 years of wars we've been in through Iraq and Afghanistan. So that system is getting hit a little bit harder than what was expected. They are reacting. We are getting more VA hospitals. We are getting more VA outpatient clinics. However, there is still that opportunity for veterans to utilize a Medicare Advantage plan to beef up or supplement kind of that care that they're getting from the VA while the VA is meeting that criteria. I go to the VA myself. I carry insurance through Cigna. That's just my backup plan. That's how a lot of veterans are going to approach this when it comes to Medicare Advantage. It's just a backup plan. The VA does provide really great care for a lot of us. And again, it's just nice to have that ability to say, you know what, I want to go get that second opinion. A prime example of this is our Vietnam era veterans, right? I'm sure you're all familiar with Agent Orange. And if you're not, Agent Orange was a chemical herbicide that they sprayed all over the jungles of Vietnam. It was sprayed directly on our troops. Troops were handling it with their bare hands, not with protective equipment. And now we know there are over 40 presumptive conditions that are caused by that direct contact with Agent Orange, many of those cancers. So if you are working with a Vietnam era veteran that does have a cancer diagnosis, maybe they want to go get a second opinion, right? That peace of mind where they have a oncologist from outside of the VA say, this is how I would treat this cancer. And then they go, you know what, that's exactly how the VA wants to treat it too. Just gives that veteran a peace of mind on being able to treat that cancer. Or maybe there's something new out there where the VA isn't able to do, and that veteran can say, you know what, I want to go treat my cancer this way, right? So very important, and that's some of the things that would be drawing veterans to Medicare Advantage. Now, TRICARE for Life, this is where we get a little bit of confusing, and this is where for years and years and years, carriers hounded you and said, leave them alone. Don't touch them if they're on TRICARE for Life. You're going to mess it up, right? Yes and no. So we're going to go over today how we're going to work through that. But the fact of the matter is that carriers are putting plans out there with higher givebacks, with higher dental associated with those giveback plans. And folks that have served our nation for 20 plus years and retired are saying, why can't I have a part of that, right? So Medicare Advantage is becoming more and more attractive to them, which is fine. And it is okay for them to be on Medicare Advantage, and I'll share those documents with you from the TRICARE for Life handbook. But it is important that we are their educators on how that interacts and how that changes benefit coordination for them. So with TRICARE for Life, coverage is automatic if they have Medicare Parts A and B. It starts that first day their A and B goes effective, and they will need to pay those Part B premiums. And we know every year that goes up, which is another factor driving TRICARE for Life folks to say, you know, that give back is looking pretty good when you have a husband and a spouse. Maybe the wife served in the Navy for 25 years. Now her and her husband are paying $185 a piece for their Part B premium, and they're saying, why can't I have a part of that either? So that's what we're going to cover today, and I'm going to teach you how to navigate that. And then that coverage is available worldwide for TRICARE for Life. Now, Champ VA, I said we're going to kind of go through it a little quick. Nothing too crazy here, but Champ VA is for a health benefits program in which the Department of Veterans Affairs, VA, is going to shares the cost of certain healthcare services and supplies for eligible beneficiaries. Now, for those eligible beneficiaries, we're talking about spouses of veterans that either were spouses of someone that passed away from a service-connected disability, or you could have a veteran that is considered 100% total and permanently disabled from the VA. Now, don't get that mixed up with Social Security. That is two different disability systems there. So VA can have someone be rated as 100% total and permanent. That does not necessarily mean that transfers over to Social Security. So it's important to keep that apart. But that is two of the main ways people become eligible, beneficiaries become eligible for Champ VA. among some others, but those are the two most common we'll run into. So things we need to know here is that they, just like TRICARE for Life, they need to enroll in or remain enrolled in their Part B for Medicare. They will pay that Part B premium, but outside of that, there is no premium for their coverage. The coverage is going to be free for them. There are deductibles and copays associated with using CHAMP VA, and they are, just like TRICARE for Life, going to need to look at picking up a dental and vision plan there. The impact on Medicare, same thing as TRICARE for Life. So once someone on CHAMP VA becomes eligible for Medicare, just like TRICARE for Life, Medicare becomes the primary payer, which is why we run into coordination issues, and which is why carriers used to tell you long ago, absolutely stay away. It's not worth dealing with the coordination. But again, we're going to go over that today. And unlike VA, where there is no coordination, remember I mentioned that, CHAMP VA and TRICARE for Life does, which is why it's important we know how to navigate that. CHAMP VA is always going to be the secondary payer to Medicare, just like TRICARE for Life. And they are not required to enroll in Part D, because the drug coverage they have for both CHAMP VA and TRICARE for Life is credible coverage for Part D purposes, including VA. Now that side by side, so I know I said a lot, this is that screen I told you. I want you to screen grab, take a picture of it with your cell phone. This is kind of the 5 W's of VA healthcare, TRICARE for Life, and CHAMP VA. And you'll see there's a couple boxes there where it blends together. Like I said, TRICARE for Life and CHAMP VA interact very similarly to Medicare. But as you can see here, so Veteran Affairs Healthcare, that's that qualifying veteran, right? But remember, I said that's not automatic. We are doing a much better job with our veterans that are getting out of service today. And when they go through a TAPS program, when they're leaving the service, they're typically meeting with a VA representative and working on getting signed up for the VA. But the demographic that we're working with specifically to Medicare right now did not get that. Most of them were told to actually take your uniform off when you get back stateside and don't let people know you're a veteran. So they did not trust the VA. They did not get enrolled in the VA. So that's why we can't always assume that a veteran we run into is VA. And this is going to go into a few slides forward when I go into how we're going to interact with them, find them, what we can do to be helping them. So what is VA healthcare? It's that healthcare provided by the VA at VA clinics when it's after discharging from the military and again, applying to receive those benefits. They're getting it at VA hospitals, clinics, and participating community care networks. And why shouldn't we provide qualifying veterans with healthcare and other benefits after we just sent most of them off to go fight wars on our behalf? TRICARE for Life, specifically, that's going to be your retired veterans and their families. So children can be on TRICARE for Life up to around 26 before they're going to be forced to jump off. But you're still going to be looking at husband and spouses as long as they stay married. Both folks will be eligible for TRICARE for Life. Similar coverage as a Med Sup plan with drug coverage. That's actually the best way to look at TRICARE for Life and CHAMP VA. You can look at them as having a Med Sup with drug benefits. Best way to kind of put them into context of how we work in the industry we work in. And then again, and they enroll, once they become enrolled in Medicare Parts A and B, their coverage will continue automatically on TRICARE for Life or CHAMP VA. TRICARE for Life has that worldwide coverage. CHAMP VA is going to be any provider accepting Medicare in the US. And the whole purpose of both of these programs is to create wraparound Medicare coverage for retirees, their families, and providing qualifying spouses and their dependents with care and assistance as well. So to dive a little bit deeper into VA benefit coordination, I know I talked a little bit about this before, but again, there is no overlap with MA and VA. So VA and Medicare, their two systems do not talk. One can't bill the other for anything. But why do we get this question? Why do we have veterans always saying, I'm afraid to get on Medicare because I don't want it to mess up my benefits? Well, that's because every time we go to the VA for an appointment, we check in at a little kiosk. The kiosk says, do you have any other insurance or do you have Medicare? Right? That question about other insurance is because VA, if you go to a VA clinic for a non-service connected condition and you're not a priority group 1 veteran, VA can collect money for services provided from your health insurance company. Me personally, I'm a Priority Group 1 veteran, but let's say I wasn't. Let's say I was Priority Group 5 and I go to the VA and it's for a non-service connected condition. They have the ability and the right to charge my Cigna Healthcare to recoup costs for taking care of something that was not caused by my time in service. So Priority Group 1, what is that? That's going to be a 50% disability rating or higher. And then it goes all the way down to Priority Group 8, which is going to be, you make too much. We appreciate your service to our country, but you make too much money to qualify for VA benefits. Now, a veteran can always go to the VA for service-connected conditions, but if they go for non-service connected conditions and are that lower priority group, there could be some cost share associated with that. Now, new this year in January 2024, as long as a veteran has a 10% disability rating or higher, copays went away for them, which is a great thing. Copays used to be very high at the VA, up to $50, in fact, to see a specialist. So now we just need to have a 10% disability rating or higher, which could be ringing in your ear is the most common. I'm not an expert on that side of things, but that's how I got 10% ringing in my ear from some loud noises overseas. And but anyway, so it's great to see those copays drop down. But again, they could have some cost share if they're lower priority group. Drug coverage. So I know in the years past, we've always hammered MA onlys, MA onlys. If they're going to the VA, they should be MA only. Well, if you've been in this business for a few years and you kind of look at how MA onlys were, what were we doing? We had high givebacks, high dental, and that's what we are utilizing, because for a VA veteran that's not getting dental coverage, unless they had a dental injury, that was what was enticing to them. So then we got it stuck in our minds that if you're a veteran going to the VA, you should be MA only because you have prescription drug coverage that's credible through the VA. But why can't they be on an MAPD? They can be. So if you're here in Charlotte and you have an MAPD that has a 174.70 give back, you're not changing anything for that veteran Medicare Advantage wise, because remember, there is no coordination. You're just increasing that give back and potentially dental. So it's important when we're talking about veterans that go to the VA, we could be talking MA only, we could be talking MAPD. It's kind of getting back to that needs analysis and seeing what it is that veteran needs. Is that Part B premium the most important to them? Is dental the most important to them? Do they want to see a mix of, hey, maybe I don't need the highest give back or the highest dental. I want that kind of medium ground. But that comes back to you and doing that needs analysis and going through there. Now with VA coverage changes, which is why it's important for veterans to enroll in VA or enroll in Medicare, which I'll share you that document, is what a lot of folks don't know is VA healthcare coverage has to be funded every year. This isn't a thing where VA just has unlimited money to do whatever they want nonstop. Congress needs to vote on a bill to fund VA. So basically, VA gets a report together and says, this is what we need for funding next year. And if you pay attention to politics at all, the last couple years, Congress has pushed back on VA funding. They've relied, veterans have had to rely on groups such as the Veterans of Foreign Wars, American Legion, DAV, which I'm going to touch on in a little bit, to reach out to their members, to call congressional figures and say, you need to fully fund VA. So again, VA recognizing this, VA now in their own VA healthcare overview guide, which again I'll share, has a section where it says VA does not recommend you decline or cancel Medicare when you become eligible. And they list those very reasons. One is expanded care options outside of the VA, and we don't know what that financial coverage is going to look like in years to come. I've already said we have a priority group 8, which was veterans that say, hey, we appreciate your service to our country, but you make too much money. Or priority group 7, if the VA doesn't get proper funding, they can just say, hey, you know what, priority group 7 and 8, we're very sorry. We can no longer fund any coverage for you, right? So it's important that veterans have Medicare Advantage in their back pocket, just in case things like this happen. And then I covered that expanded options. Even the VA has brought that up and said it's important to be able to go out and get those expanded options, such as, dental or extra vision coverage or help with that second opinion, things along those lines. Now, TRICARE for Life. I told you that we're going to break this down really simple, and it's going to be really simple, I promise you. So TRICARE for Life, how does it work? I'm going to go over how it works right now. If they're on original Medicare, okay? So picture someone you just met, TRICARE for Life, they're on original Medicare, and they no Medicare Advantage. They can go to any authorized provider. So again, we're thinking of them as in they have a med sup with drug coverage. What happens when they get there? In most cases, more often than not, almost all the time, that provider is sending a entire bill to Medicare, okay? So that provider goes and sees them. That veteran showed their Medicare red, white, and blue card, their military retiree ID card, and then that provider is sending the entire bill to Medicare, right? So there is no coordination that that veteran had to do on their part. Medicare is going to pay its portion, which is roughly 80%, just like it does for everybody on original Medicare. And then Medicare is sending the remainder of the bill to the TRICARE for Life claims processor, which is named Wisconsin Physician Services. Now, I'm going to say that again, Wisconsin Physician Services, because if you have a client that's on TRICARE for Life and ran into a billing issue, Wisconsin Physician Services has a customer service department they should be calling to help mitigate that. Those folks are very well versed on how all of this works together and can usually get that problem solved. And then after that, like I said, TRICARE for Life then pays the provider directly for those TRICARE covered services, roughly that other 20%. That is in a nutshell how it works right now when a veteran on TRICARE for Life or a spouse of a veteran on TRICARE for Life goes to a provider on original Medicare. Okay, now what we change here is I'm going to go back just a little bit. Now, how does TRICARE for Life work if we have a Medicare Advantage plan? Now, a Medicare Advantage plan, we know usually is going to have some sort of network associated with it. So now we've changed this part where it says you may visit any authorized provider. It's still an authorized provider, but we still want to make sure that they're in that network for whatever Medicare Advantage plan that they're on. Now, instead of the provider now being able to send that bill to Medicare, what needs to happen is that provider is going to now bill, let's say in this instance, Cigna. Cigna is going to cover what they're going to cover, roughly the 80%, or if not a little more. And then the provider needs to send the remaining 20% or so of that bill to Wisconsin Physician Services themselves. So they are not relying on Medicare to do that for them anymore, which is where I was mentioning earlier, we have that benefit coordination we need to keep in mind. Now, in the Southeast, we have quite a few veterans that are moving here from all over the place. A lot of our providers are used to that. Specifically in North Carolina, we have roughly 1/3 of the Marine Corps here. Fort Bragg is one of the largest military installations in the world. We have a lot of providers that are used to or know how to deal with this in that billing office. But it is still a good thing to call that provider's office up and let them know that, hey, I have so-and-so, they're a patient of yours, they're looking at getting on this Medicare Advantage plan. This is how we would need to bill it. Are you, do you understand how to do that? And then coach them through how that would look like. For the front office, billing office, this is no different than them billing someone that walks in there with a primary and secondary form of insurance, right? Same thing. So it's just a matter of calling ahead, making sure they understand how that's going to work. Now, if that doesn't work though, or you run into a provider that says, you know what, no, I'm not going to bill TRICARE for this. What's going to happen now is that veteran or the spouse is going to be required to pay that copay or coinsurance for seeing that provider and then filing for reimbursement themselves. Now, that could be a big turnoff for a lot of folks on TRICARE for Life, especially if they've been on it for a while and are just used to not seeing any bills for anything. Now, I will let you know that that reimbursement happens within about 30 days. So it's going to be in between their Social Security checks and in between their retirement checks. But it's still important to note that this benefit coordination needs to be talked about and discussed the most with those folks you're running into on TRICARE for Life that have decided that they want to jump into Medicare Advantage. So this is where we become the coaches on that to let them know. From there, like I said, Cigna would pay its portion. Ideally, if the provider bills it that way, Cigna would pay its portion. That provider sending the bill to Wisconsin Physician Services. Wisconsin Physician Services is paying their side of the bill, and then that veteran is still not seeing any copays or coinsurance. But again, we don't live in a perfect world. They might end up with a copay. They might end up with that coinsurance, but it is important to let them know that they can get that reimbursed. So that is the trade-off for someone on TRICARE for Life that is looking to get on Medicare Advantage. And that's what we need to be most cognizant of when we're working with those folks and say, the gym membership is great, the extra dental is great, the vision's great, the give back's great. Here are some trade-offs though that you're going to need to make sure that you're aware of. And then you'll determine, are those trade-offs still something that that veteran or the spouse of the veteran still wants to do. Now, just real quick, side by side here, TRICARE for Life versus VA only veterans here. So TRICARE for Life veterans, again, can access care from any authorized provider. They have a standalone prescription drug plan sponsored by Express Scripts. Copays vary. Now, sponsored by Express Scripts is important because I'm going to talk about that coming up here shortly. But there are copays associated with those prescription drugs. Now, if they live near a military installation, they can usually go on base and get those prescription drugs for free. There's discounts for having them mailed. But if they go to pharmacies outside of that, then there are going to be copays associated with that. Dental plans are going to have premiums. Cost share can be up to 50% of coinsurance. So that's why dental is something that also intrigues TRICARE for Life veterans and maybe want to make the move over to Medicare Advantage. And that's usually around a $1,500 annual maximum benefit. Now, our VA only veterans, again, those are veterans that have to access care at VA or VA approved community care network locations, of course, with that referral. Now, remember earlier when I said that VA is not credible for Part B purposes, but it is for Part D drug. And that is because veterans that utilize VA and utilize the pharmacy from the VA have a max out of pocket of $700 for the year. Now, mind you, if they're picking up prescription drugs for their service-connected conditions or they're that priority group 1 veteran, they're not paying any money for their prescriptions. But for everyone else that doesn't meet that criteria, now you can see why VA is credible for Part D with that $700 max out of pocket, which is far lower than the up to, I think, $2,100 we're jumping up to this year potentially. Again, VA doesn't offer dental benefits under most circumstances. That veteran's going to need to have a dental injury or be 100% total and permanent disabled before dental pops into any really discussions there. So this is why it's important things. You can see a reoccurring theme here. Give backs, dental, right? It's kind of that reoccurring thing, which is why veterans, both VA and TRICARE for Life are looking to come over to Medicare Advantage. And again, VA is considered credible coverage for ACA purposes, but again, not Medicare Part B. So I think that's also why we run into a lot of confusion once veterans become Medicare eligible, because every February or so we get a letter saying that you've had credible coverage the year prior for when we file taxes. So they get used to that. Then they turn 65, become eligible for Medicare. That letter stops coming in the mail because you now no longer have credible health care coverage. So that's why it's important for them to sign up for their Part B. And again, I'll show you where the VA shares that information. And there is no SEP for a veteran that canceled or declined their Part B and decided 5 years later, I need it. They're going to be hit with a penalty just like everybody else. So Champ VA, again, I'm going to go through this real quick. Same exact thing as TRICARE for Life. So if they're on original Medicare, any provider, most cases that provider is going to file the claim with Medicare, the whole claim. Medicare is going to pay its portion. They're going to send the rest to Champ VA. Champ VA is going to pay their portion directly to the provider, and no money exchanges, no copays, no coinsurance, no anything. You get someone on Champ VA that's Medicare Advantage. Again, we're following the same process that we did for TRICARE for Life. Let's call up these providers. Let's make sure that they're going to bill it properly, understand how to do it, and that beneficiary understands the changes that are going to come up with that. Now, the one big difference here between Champ VA and TRICARE for Life is if you put someone on Champ VA on an MAPD, they will lose their meds by mail, which is their drug coverage. They can get it back, but that will supersede that and cancel out that meds by mail. So they will only solely be able to use the prescription drug coverage on that MAPD. So for Champ VA, if you want to get rid of one extra level of coordination or not have to deal with that, an MA only makes the most sense. So for TRICARE for Life, if you put them on an MA or an MAPD, they're not going to ever lose their benefits, but they're now coordinating that prescription drug benefit with Express Scripts and whatever carrier they might be on. I will give you a Cigna tip. Cigna owns Express Scripts. I'm sure you're probably aware of that. That is our PBM. So if you do end up putting a veteran that's a TRICARE for Life veteran on a MAPD, and it is a Cigna MAPD specifically, the drug benefit coordination will happen automatically on the back end at the pharmacy through our Express Scripts systems. Every other MAPD, though, they will then need to coordinate who's paying what when it comes to that. So something to keep in mind there. All right, so we're going to go over a couple of things here, just as examples. I know I talked a lot. It's a lot easier when you see examples and kind of put it in your head that way. So meet Richard here. Richard's aging into Medicare, and he's in his initial enrollment window. His Part A and B are effective on the same day. He gets all of his medications from the VA, so prescription coverage is not high on his list of needs, but with his fixed income and ability to utilize the VA, he's looking for a plan to help offset his Part B premium that he pays for Medicare, as well as a much needed dental benefit. So out there in the audience, are we thinking that Richard, what kind of Medicare plan should we be leaning towards with Richard when we're doing that needs analysis? And I realize that a lot of you are probably driving at your computers. I don't know if there's any chats coming in. Hopefully you haven't tuned out yet. But the answer is MA only or MAPD. So again, we have no coordination here between VA and Medicare. So it does not matter if they get on an MA only or an MAPD. What we need to be looking at here is utilizing that needs analysis and either finding that high Part B give back that veteran's looking for, the high dental, or some sort of mix of that. Preferably Cigna Preferred Savings here in the Charlotte market. All right, so now we're going to talk about meet John and Alicia. So John and Alicia are both retired from the U.S. military and are on TRICARE for Life. They enjoy the wraparound coverage that TRICARE for Life gives them, but are curious about Medicare Advantage with some of the included extra benefits and wonder if they would be eligible. So I'm sure this is something familiar. You've been at a kitchen table before where you have a husband and a wife, either one or both served and retired, and they have questions about Medicare Advantage and what that would look like. Typically, we would say, hey, we're going to stay away from them because they have everything they need. But as we talked about today, how we are going to manage that benefit or that coordination of billing and how that's going to work, we can talk to them about their options because it is becoming more and more intriguing to them. Like I said, why should they not be also wanting or eligible for all those extra benefits that they see on TV all the time? So now for me, John and Alicia, they can be on an MA only, which is probably what's stuck in the back of your mind because that's what we typically hound. They can be on an MAPD. I would say stick with Cigna if you're going that route to avoid that coordination of drug benefits on the back end, because again, we are going to cover that for them. That coordination happens on the back end, or just stay where they are, right? It is okay to sit down with two folks that are TRICARE for Life and not walk away with a sale. What I do want you to be thinking about, though, is where in the last few minutes I talked about is kind of that reoccurring theme for veterans, both on TRICARE for Life and VA. And that is dental and vision. So maybe you didn't walk out of there with a Medicare Advantage plan, but you could walk out of there with a standalone IDV plan. You can start to talk to them about their individual dental vision plans and still walk out of there with something and gain some business for your book and still being able to help veterans of our country get much needed care or better care than what they have available to them. So always be thinking on the fly like that when you're working with TRICARE for Life folks, as well as Champ VA. So meet Beth Ann. Beth Ann qualifies for and is currently on Champ VA. With her recently aging into Medicare and Medicare becoming that primary payer, she was wondering what her options are and if there are Medicare Advantage plans she could take advantage of. Now, as I mentioned earlier, we want to look at MA only here, or again, stay where she is. It is not a big deal. Again, same as TRICARE for Life. If they're comfortable where they're at, we can then pivot to individual dental vision plans and work that angle to still be able to provide them a service that they need. But again, we want to stay away from the MAPDs for these folks if they're utilizing that meds by mail benefit. And make sure that they understand the complications if they get onto an MAPD, and then being able to transition all of those drugs. Now, this is going to be a little, maybe not a hot take. Some of you are familiar with this. This is the window we're in right now. So meet Joe. Joe is a veteran, and he's eligible for VA health benefits, but he decided to enroll in an MAPD to get extra benefits and added flexibility when it comes to receiving his care. He's still getting all of his drugs from the VA. And he recently learned about MA only plans, specifically the Cigna Courage plan. He learned that the plan had richer benefits than his current plan, including Part B give back. But Joe missed the opportunity to use OEP to enroll in the Courage plan. Will he have to wait until AEP to make changes? So this is something you need to be thinking about right now, because these are folks you're running into. The answer is no. That veteran does not need to wait, and it doesn't even specifically need to be a veteran. That person does not need to wait. So what this is called is credible drug coverage, CDC. So that's going to be your SEP. So it's SEP CDC, credible drug coverage. And what that allows a person to do is a person that is on an MAPD plan, if they have other credible drug coverage, one time, they can use that SEP to move from an MAPD over to an MA only. All right, so again, that's SEP CDC, and that's a one-time use code. So if you're running into a veteran right now that is on a competitor MAPD or whatever it might be, and their friend, they went to their local VFW and said, hey, I'm getting this $115 a month back, and they say, well, I want to be a part of that, you can actually help that person with that SCP code. Again, they have to be on an MAPD, and then they're jumping to an MA only because they have credible drug coverage. So now into a little bit of interaction here, how we're going to put this in the field. So I always put this up. This one has a far better effect when you're in a room of a lot of people, but I'll always ask, if you're a veteran, please raise your hand. You'll have a few hands go up in the room, right? And then what, we got 1, 2, 3, 4. We have 5 people in this room. All right, so if you're a veteran, raise your hand. Okay, I'm the only one. Now, if you're a family member of a veteran, either 2 generations up or 2 generations down, raise your hand. So grandfather, it could be anything like that, grandmother. No, okay, so we got an extra hand though. But what typically happens is you get a lot of hands go up in that room because they say, oh yeah, my grandpa was in World War II, or my grandpa was in Vietnam, right? So what that is this little wheel right here is the membership wheel. So a lot of folks ask, how can I get involved with the veteran space? What can I do? The majority of us are eligible to join these organizations. So the big 3 that I'm going to put on here are VFW, American Legion, and DAV, right? So they each have their own kind of criteria. So VFW, it's in the name, veteran of foreign war. So you had to have been related to or a veteran that served overseas, received hazardous duty pay. American Legion is any honorably discharged veteran. That is the largest veteran organization, I believe, in the world because of that. And then DAV is our Disabled American Veterans. But if you're in that wheel, you're eligible to join. So I tell folks all the time, you're already a part of the veteran family. So just stop by a local post and let them recruit you in, or stop by and see how it's going and say, hey, you know, my grandfather or my dad served wherever it might be, or my grandmother served, whatever it might be. My son is currently serving. My daughter is currently serving, right? You already have an in to get in there, and you can talk about that and let them recruit you into that organization. And I use this example a lot if you've been in any of my trainings before. At my VFW, I have 3 plumbers I know, right? So if I have a plumbing issue at my house, and I would knock on wood, I haven't had one yet, so I'm going to keep knocking on wood there. But I have 3 plumbers that I know I can call to say, hey, I just had a pipe burst, whatever's going on, can you come and help me? And I know they'll come over, at least one of them, if they're not working right, can make their way over. They can get done what I needed to get done. They're going to do it the right way, and they're going to do it at not charging me an arm and a leg, right? So what's the difference between that and an insurance agent? There's really not, right? So I've been at my VFW for, I don't even know, 15 years now. Come October, I get a lot of calls from agents, which is always good. I appreciate your phone calls coming in, but I get a lot of phone calls from veterans saying, hey, what should I be doing with this, Andy? Right? Because I'm in there, I'm a part of that group, and they know that this is what I do. So there's no reason why, if you're eligible for these organizations, that you shouldn't be. And it also is important because, like I said, that VA funding, when that call goes out and they say, hey, we need you to call congressional members, VFW can say, we have 2 million members. The American Legion can say we have 3 million members. The DAV can say we have however many million members, right? Those are numbers that mean something on Capitol Hill. So it's important to join. Even if you don't become active, just join to help out veterans across this country with the funding. So I'm almost done here. Stick with us. So we're going to go into the resource guides. And again, I'm going to email these out so you'll be able to get them. You'll also be able to find them on Producers U if you log into your Cigna for Brokers account. But from there, you can get the job aid for how Medicare Advantage works with TRICARE for Life. It goes over everything for you that I went over for you, and it's customer facing. So you don't have to be the sole expert there. You can go over this with your client, the beneficiary that's sitting in front of you. Also have one for VA health. And then we also have one that goes over courage plans and what that looks like. One thing that I think a lot of folks don't realize that we have at Cigna is we have a specific veteran support line. So if you have members that are veterans and need help with coordinating something or need help with something Cigna, one of their Cigna plans, the veteran support line is 855-244-6211. Again, that's 855-244-6211, and that is specifically a veteran support line that Cigna maintains. And I talked a lot about those resource guides, okay? Again, I'm going to email these out to you. You can just Google them as well and find them. But the healthcare benefits overview, I know I have a picture of the 2024. The 2025 is out. But on roughly page 17 of that document, you're going to see where VA talks about Medicare and why veterans shouldn't decline Medicare. The TRICARE for Life book just came out new this year. They come out with a new one every 3 or 4 years. So you can download that. I just download the PDFs, save them on my computer. I have a little veteran folder. And when I go into these places and a veteran asks, hey, well, why should I get on my Part B? Or I have a TRICARE for Life person telling me that, well, I can't be on Medicare Advantage. I say, well, don't take it from me. Here's actually your resource guides and the organizations, either the VA or TRICARE for Life, showing you that you can and how that works alongside each other, right? How that would look like. So important to have these because, again, we are out running into a lot of folks that might not necessarily trust us at first. That's fine. But having these resource guides on your computer or tablet, however you work, ready to go, is a great spot to be able to go over that with them. Or even if you're watching this and you're a call center person and you're going back and forth and you can email this client and say, let me email you over this document, or go to this Google site. We're going to go to this VA healthcare overview guidebook and I'm going to talk to you about this, right? Just have these at your disposal because now it's the VA, it's TRICARE, it's Champ VA telling them that, yes, not only can you be on Medicare Advantage or should be on Medicare Advantage or should be on just original Medicare, but here's what it looks like when you do, right? So use those guides to your benefit. And then that's where I'm at with questions. I don't know if we get a lot of questions coming in. I know I talk fast, so I apologize.
Yeah, no, I don't see any updated questions or new questions.
Maybe you can't see them.
Okay, unfortunately, I don't see them.
Okay, so we got some questions coming in.
I've met veterans who are very patriotic and don't want the government to pay their costs of the MAPD. How can I answer this? And you might be able to reiterate.
Okay, so the question, say it again. I run into a lot of veterans that are patriotic and they don't want the government to pay for the cost of their MAPD.
How can I
Okay, so how I would answer this is we run into this a lot with veterans, especially Vietnam era or older veterans. They say, well, I don't want to get signed up for the VA because I don't want to take away that money from veterans that need it, right? Here's the deal. VA is going to go out and get its funding. Medicare is going to go out and get its funding. So the more people that are enrolled in these programs, the more funding that those programs get. So in fact, you're actually helping out folks by being a part of these groups to help increase funding of that. So we use that a lot. Even if you enroll in the VA, if you don't want to utilize it, that's fine. Still enroll because VA is going to get funding based on that. And then for the patriotic part, I love that. It's nice to be patriotic. Really enjoy that. But when that veteran, he or she becomes 88 years old and needs a surgery, that VA funding has been cut and now they don't have coverage for it. It's not very patriotic for a country to not take care of that veteran. So they should just be in here and be a part of that to make sure that they're always going to be taken care of by one part or another of our government. So funding, I would say, would be the most important thing.
So Andy, we have a question which we both could probably, what about offering a hospital indemnity plan? That work?
So hospital indemnity plans, that is something we could potentially do. I would say it's going to be depending, right? So if we're talking to the veteran about this plan and you're going over it with them and it seems to be a great fit, that sounds great. For a veteran that's VA only veteran, for example, let's say I get into a car accident, I'm taken to whatever hospital. What I say, or hopefully I can talk, or my wife would say, or someone on my behalf would say, hey, he is a VA veteran. He needs to be transferred to the VA hospital at the, whatever time, that it's safe to move. And at that point, VA is covering that bill. All right. But that is not to say that there are issues out there where a veteran goes to a civilian hospital. Maybe they decide they want to stay at that hospital longer, or something happens where there were some issues there. And now there are veterans that get bills for hospital stays and it bankrupts them, unfortunately. And that usually it's very sad to see. It's a horrible thing to see. So I would say going through your needs analysis, going over the hospital indemnity, let's look at factors such as, where's their closest VA hospital to where they currently live? What does that kind of look like? Things along those lines. But I would say it's not out of the question. Again, just as that backup plan. Most veterans, we know as soon as you kick a door in, guess what? The plan you had going in there, it's not working. So we're already on plan B, C, and D sometimes before the last person even enters a room. So it could be a thing in their back pocket if it financially makes sense, just to give them that added level of coverage, kind of like a reserve chute if your main doesn't open, sort of thing.
Thank you, Andy. All right, I have questions now. Since Cigna sold their Medicare business, how will this affect us going forward into 2026?
I'll let you take this.
Okay, I'll take it. So we talked about how we were sold to HCSC March 19th. So we still had to file. We did our bids. We have our plans that are all filed under Cigna. So our plans are all filed and ready to go. So those are all set. We are going to be under HCSC with a new name coming, and that's really it. We're just going to have a name change. So everything else will be the same for 2026. We have really strong, solid plans moving into 2026 that we'll be able to share late July. But everything will be status quo. We just will have a new name. So you'll still be able to work with me. You'll still be able to work with Andy, the same team, the same systems. We have some updated systems that we're using. So everything should be very smooth. And I can say for me and Andy, I'm going to speak for you, but our transition as employees has run very smoothly. So we're actually very, very excited with our new parent company.
Absolutely.
So if you have more questions about that, feel free to go in with that.
Did I hear a sneak peek about strong plans for 2026?
Strong plans. I like to say strong plans. Okay, VA gets funding if someone enrolls in an MAPD plan.
So
that was a question.
Sorry. Let me reiterate. So VA is going to get funding based on membership, and then Medicare pool is also funded based on projected memberships. So they are two separate government pools, but they are being funded based on projected and actual numbers of folks in those pools. So again, separating the two, but I was just using that as an example to say, this is why you should enroll in Medicare. First off, the VA tells you to, but let's keep increasing that pool. And then the same thing on the VA side. If you're not enrolled in the VA, let's get you enrolled in the VA, increase money in that pool.
Okay. And is there a special needs questionnaire prepared for veterans?
Not specific to veterans. What I would say is for you personally to add to your questionnaire as you're kind of doing your needs analysis, if they are a veteran, you run into a veteran that is not enrolled in the VA, I would add that question to your own how you do business. So it's like, hey, are you a veteran? They say yes or no. Are you enrolled in the VA? They say yes or no. If they say no, that's a really good way to get them linked up with, at least here in North Carolina, every single county. If you Google Mecklenburg County Veteran Services, it's going to bring up that county services office. And that is a great spot to go meet that veteran service officer that works at that county office. So when you're running into veterans out in the field that pass your questionnaire and say, no, I'm not enrolled in the VA, but they want to be, you're linking them up with that county veteran service officer, develop that relationship there. And then hopefully with that veteran service officer, they're going to have folks coming to them to get their VA benefits. And then they say, hey, thanks for helping me with my VA benefits, but what do I do about Medicare? And they're like, oh, well, why don't you give John a call? John can help you out with that, right? So utilize that. I would kind of create your own questionnaire on that, but there won't be a separate veteran versus a normal beneficiary.
Okay, I think we only have a few minutes. What is better for a vet, a hospital plan, or MAPD, MA plan?
So again, that's going to come down to the needs analysis. I would say we're looking at, for a VA veteran, we're figuring out the main needs there. The main needs are going to be, they're probably paying their Part B premium and going to the VA for the majority, if not all of their care. So they're looking at that as saying, I got $185 coming out of my Social Security check for something I don't even use. So that Part B buyback is going to look pretty intriguing to them. And then unless they meet that dental criteria, they're probably not getting dental either. And if you go to the VA and they wear glasses, the frames and the things like that VA has, it's pretty generic. It's not as bad as when they were in basic training, but they're pretty generic lens and frames. So that could be something that intrigues somebody too. They say, hey, I want to go and utilize frame, right, at wherever to get frames that are not from the VA. So again, I would be using that needs analysis to figure out what their needs are. Typically, what I see is either somebody that doesn't care about dental, wants all the money they can get back as possible for their Part B premium, or you're going to have someone that says, I need all the dental I can get. I don't care about the Part B buyback this year. Or you're going to get those people that are kind of like, you know what, I'm happy. Give me somewhere in the middle where I get a decent amount of dental, a decent amount of give back, and they call that good. So I would say settle on your needs analysis there and let that drive it.
Okay, we have a few more questions. I think we're going to have to share the answers. But do we have PPO plans in the Charlotte metro area with Cigna? Yes, we do. You can go to Cigna for brokers for that. Definitely email Andy. Is there some approved social media posts? We can share that. Veteran social media posts, I'm not exactly sure. And then the last one, could you share more about IDP plans, please? And yes, we could share more of that in an email.
Yep, I'll get all that added with all those resources. All right, well, thank you all. We appreciate you coming out and hopping on. And for those of you watching the recording, talk to you soon.